Let's go now to the major skeletal muscles. There are over 600 muscles in the human body. All muscles possess the origin, insertion, action. It actually also includes the nerve. Kaya minsan tawag namin dyan moina. Muscle, origin, insertion, nerve, at action. Yun yung usually pinag-aaralan when it comes to the muscles. So this is what our muscles look like. Diba? Kung makikita nyo siya. Ito lang yung mga sikat, pero actually madami pang muscles sa katawan natin na we will discuss as we go on. So this is the anterior view. This is the posterior view. So in discussing the muscles in anaphy, mag-focus tayo kung saang region natatagpuan yung muscle na yon and yung action ng muscle. Hindi ko na masyadong i-dig deeper yung origin at insertion niya kasi anaphy pa lang naman tayo. Sa other anatomies kasi yung mga toxic na ganun. Okay? So first, let's start with the muscles of facial expression and mastication. These muscles actually produce a facial expression that will help us communicate our feelings. It also raises the mandible in process of mastication, or chewing, or even eating. Okay? So these are the muscles of our facial expressions and mastication. Remember kung saan sila matatagpuan ha. So this is in the face, of course, or in the head region. Okay? So, ang mga muscles involved dito ay temporalis, the frontalis, the occipitalis, the orbicularis oculi, the zygomaticus, the buccinator, the orbicularis oris, the platysma, masseter, Splenius Capitis, and the Sternocleidomastoid. Now, isa-isahin naman natin ngayon ang mga structures na yan. First off, we have what you call the Buccinator. So, kung makikita nyo siya sa structure, nasa may cheek area natin yon. So, siya yung nandun sa may medyo depressed area or malambot na area ng ating cheeks. Diba? Ayan yun. So, the buccinator muscle is actually responsible for the blowing, the sucking, the whistling, the puffing of the cheeks. So, once na nag-puff tayo ng cheek or nag-whistle tayo, usually buccinator talaga yung naganang muscle doon. So, the origin of the buccinator is actually in this area. Hindi ko na sasabihin kung ano, kasi hindi nga natin siya i-dig deeper. Basta nandito yung kanyang origin sa area na to. Okay? Next, we have the Epicranius, which includes the Occipitalis and the Frontalis. So, based from the name, malalaman nyo kung saan siya located. The Occipitalis is located in the occipital bone, while the Frontalis is located on the frontal bone. So, pag pinagsama sila, ang pangalan nila ay occipitofrontalis muscle. Ang action ng occipitofrontalis muscle is actually raising the eyebrows. So, pag nag-raise tayo ng bilateral eyebrows, occipitofrontalis muscle yung involved doon. So, yung origin actually ng mga yan, so, si occipitalis, andito siya sa area na yun, of course, in the occipital part. Yung frontalis naman, sa may frontal bone, syempre. Next, we also have what you call the Orbicularis Oculi and the Orbicularis Oris. From the name itself, Orbicularis kasi medyo pabilog yung kanyang structure. So, this Orbicularis Oculi acts, or ang action niya is to close the eyes. On the other hand, the oris closes the lips. Okay? Oculi is for closing the eyes. Oris is for closing the lips. This is also the kissing muscle. Next is we have the platysma. So, kung makikita nyo ang platysma or mapapalpate nyo, dito siya sa may panek area. The actual function of the platysma, or the action rather, is it depresses the angle of the mouth. So, once bilaterally mong dinepress yung angle of the mouth, lalabas or magkocontract tong platysma. Platysma is also called the EGOD muscle. Next, we have the Zygomaticus Major. Actually, in Zygomaticus muscle, meron tayong major at minor, but let's only discuss the major. So, Zygomaticus Major is actually located in the Zygomaticus bone. Of course, kaya yun yung pangalan niya. So, this is actually responsible for smiling. So, kapag nag-i-smile tayo, alam na agad natin na Zygomaticus Major ang responsible doon. So, ang origin niya, of course, is matatagpuan mo din sa Zygomaticus bone. Next, we have the Masseter muscle. So, yung Masseter muscle, makikita nyo siya sa area na to. Ito yung kanyang shape and yung location. So, masset means chew, meaning ang action ng masseter na to is chewing. It is responsible for chewing of the food. Diba? So, ito pa siya. Andito yung ating masseter. So, ang origin niya is in this area. Ang insertion niya nandito sa area na to. So, actually, ito yung insertion niya kasi 'di ba itong mandible natin ang mas movable rather than dito sa area na to. Next is we have the temporalis muscle. Of course, it is located in the temporal bone. Kaya siya nandyan sa area ng temporal bone. Ito yung structure niya. Another picture. Yan. It is actually responsible for the closing of the mouth. So, once na nag-close ang mouth natin, isa si temporalis sa mga responsible for that. So, ang origin niya is, of course, in the temporal bone. Ang insertion niya is nandito sa area na to. So, kasi ito yung pinaka-movable. Diba? So, let's move on with the muscles that move the head. These neck muscles are responsible for flexing or bending, extending, and turning the head. So, all the muscles that I will say in the next slides ay ang function nila or ang action nila is itong mga to. Hindi na natin sila iisa-isahin pa. I mean, yung action nila. So, let's start with the Sternocleidomastoid. So, nasa neck compartment siya. Nasa neck area. So, ito yon yung pa-oblique sa may neck natin. So, madali lang siyang makita kasi medyo malaking muscle to sa neck natin. Yan. So, action niya, like what I've said, is movement of the head. It can extend, it can flex, it can rotate the head. So, ang insertion niya is nandito sa area na to, while the origin is nandito sa may clavicle area. Now, the insertion is higher than the origin in this scenario since the insertion, di ba sabi kanina, is the most movable part of that muscle. Since movement of the head nga tayo, kaya yan yung kanyang insertion. Next is we have the Splenius Capitis. So, ito siya. Medyo pa-oblique din siya. However, nasa likod siya or nasa back part of the neck. Diba? Another picture. So, nasa neck siya na pa-oblique din. The origin niya is nasa mga vertebral columns. On the other hand, ang insertion niya is still in the head. Kasi yun yung movable part. Move on to the other muscles of our body, which includes the muscle in the anterior trunk, the anterior abdomen, and the back. So, in here we have the trapezius, the deltoid, Pectoralis Major, in this area, the external obliques, the Transversus Abdominis, the internal oblique, the Rectus Abdominis, the Serratus Anterior, the Intercostal, and the Pectoralis Minor. So it also includes the linea alba, which is a band of connective tissue, and the aponeurosis of the external oblique. Next, in the back, we also have the trapezius, the deltoid, the latissimus dorsi, the levator scapulae, the supraspinatus, infraspinatus, teres minor, teres major, the rhomboids major, tapos ito yung rhomboids minor. Let's now discuss the muscles of breathing. Primary breathing muscle is the diaphragm. So yes, diaphragm is a muscle. It separates the thoracic and the abdominal cavities. Muscles in the ribs or of the ribs also assist in breathing. Always remember what compartment or what area will you find the muscles that we are going to discuss, okay? We have the diaphragm. So this is the diaphragm. It separates the thoracic from the abdominal cavity. Another picture. So diaphragm is actually responsible for the inspiration in our body. It is also the primary muscle for respiration per se. Next, we have the external intercostal. So if isa-side view mo yan, mas front siya sa unahan ng ating ribs. Okay? Yan. So, ito yung kanyang origin. Nandito sa area na to. Yung sa mga ilalim ng ribs. And then, the insertions is yung sa taas naman ng ating mga ribs. Now, the external intercostals is actually also responsible for inspiration. Next, we have the internal intercostal. So, mas inner siya. Mas medyo labas yung external intercostal, hence external. Tapos, mas internal tong internal intercostals. Nasa name naman niya. So, this is actually also responsible for breathing, for respiration. Next, we have what you call the muscles of the abdominopelvic wall. Meaning, these are the muscles in our abdomen. Abdominopelvic. So these muscles provide support for the anterior and lateral portions of the abdominal and pelvic region. It also supports internal organs. So as you can see in this picture, the abdominopelvic muscles includes the rectus abdominis, internal obliques, transversus abdominis, external obliques. First, we have the rectus abdominis. From the word rectus meaning straight, kaya yung orientation nito is pa-straight lang. So, rectus abdominis is actually responsible for the forceful expiration. So, here you can see na yung rectus abdominis is tinatransect siya nitong linea alba, which is a connective tissue. Tapos, meron din siyang, sineseparate din siya ng mga tendinous intersections. So, ang insertion niya is nandito sa area na to, yung mga blue. Next is we have what you call the lateral abdominal muscle, which includes the external abdominal obliques, the internal abdominal obliques, and the transversus abdominis. So, this is the most superficial, then this is the innermost rather. So, for the external abdominal oblique, makikita nyo dito na ito ay pa-V yung orientation. Pa-V, papasok siya sa loob. Unlike the internal abdominal, palabas naman siya. So, parang pa-A. Ito pa-V, ito pa-A. Kasi palabas. Yun yung internal abdominal. Now, the transverse abdominis is pahiga lang yung kanyang orientation. So, most of them are responsible to protect the abdominopelvic walls para masupport niya yung internal organs sa loob. So, another picture. So, internal abdominal obliques, yung pa-A. Tapos, transversus abdominis, yung transverse or yung pahiga lang. Next, we have the muscles that move the pectoral girdle. The muscles in this region actually originate on the bones of the axial skeleton. It also inserts on the scapula or the clavicle. However, the scapula moves more freely than the clavicle because it is mainly supported by muscles. In here, we have the Pectoralis Minor, the Serratus Anterior, the Trapezius, the Levator Scapulae, and the Rhomboideous Major, and this is the Rhomboideous Minor. So first, let's start with the trapezius, in which other term niya is the shoal muscle, S-H-A-W-L, sa Tagalog, balabal, because as you can see in the structure of the trapezius, kina-cover niya yung back. It's like the shoal covering our body. The trapezius actually has 3 fibers. The first fiber, which is the upper fibers, elevate the scapula. The middle fibers pull the scapula medially, while the lower fibers pull the medial border of the scapula downward. So, ibababa niyo yun. So, upper fibers elevate the scapula, middle fibers pull the scapula medially, and the lower fibers pull the medial border of the scapula downward. So, the origin of the trapezius is actually in this area and in the vertebral columns, in the spine, right? Then, nag-insert siya here sa spine ng scapula and sa may clavicle. Next is we have the Rhomboideous Major. So, as you can see, yung orientation niya is medyo paslanting in the back area. Here, the origin is also located in the vertebral column and the insertion is in the medial border of the scapula. So, it is responsible in raising the medial border of the scapula upward and medially. So, pag ganun niya nire-raise yung scapula. Okay, pag ganun, hihilahin niya tong medial border pa upward and medially. Pag ganun. Next is we have the Levator Scapulae. Based dito sa anatomy niya, nasa medyo likod lang siya ng ating SCM, the Sternocleidomastoid. So, based from the name, Levator Scapulae, we can deduce kung ano yung action niya. From the word itself, levator means elevation, then scapulae for the scapula. Ang action ngayon ni Levator Scapulae is the elevation of the scapula. Next is we have the Serratus Anterior muscle, kung saan matatagpuan mo siya dito sa mga sides ng ating ribs. Medyo malaki siya, kung titingnan mo. So, ang origin niya can be found in the ribs, as you can see, and insertion niya is in the medial border of the scapula again. So, its action is to draw the scapula forward around the thoracic wall, and it rotates the scapula as well. Next, we have the Pectoralis Minor. So, kung makikita mo yan sa book nyo, is para siyang tatlong muscle. Hindi siya yung parang buo pag book base. So, ayan siya. 'Di ba? Ang kanyang origin is nandito sa ating mga ribs. Dito sa area ng ribs. Tapos, ang kanyang insertion ay nandito sa may coracoid process. Always remember that the insertion is more movable than doon sa origin. Okay? So, Pectoralis Minor is actually responsible for the depression of the point of the shoulder. However, kapag hindi nagalaw yung scapula or finix mo yung scapula, it will then elevate the ribs, which is the origin. Parang magpapalit sila. Okay? So, kapag nagalaw yung scapula, ang gagawin niya sa scapula ay i-depress niya. Pero kapag fix si scapula, ang action niya is i-elevate niya ngayon itong ribs.